So for those I have yet to meet, my name is Keith Covers. I'm one of the medical directors along with Michelle Nightpaver. And I have a pretty fun job right now. So we pulled together some medic by the numbers to talk about the sort of reach, impact, connections, relationships related to medic. So I'm going to walk through these. And hopefully you find them as interesting as we do. And I want to thank Megan and Yuki from the Coordinating Center who really sort of had the concept and sort of wrangled the data for us. So let's start with something pretty simple and obvious, which is growth of our network over time. So we'll kind of take a historical turn here. Medic started almost 10 years ago in 2015. These were the originals, inaugural sites from that time. And you can see that we really had to sort of build a lot of trust in this. I think they were, it was a bit of a flying the plane, building the plane at the same time moment. And a lot of them are still here. Then in the following 2 years, added a few more sites, as you can see here, up to nearly 20 hospitals at that point. And then a few more in the following 2 years. Of course, 2020, as you recall, is the pandemic year. And so obviously there's a lot of like clinical strain, but there was also a lot of financial strain on hospitals and health systems. So we also had a few hospitals exit Medic at that point, Legacy Beaumont, DMC, Hurley, but we're still open for business, hoping they come back in. But we're able to supplement some of those losses with a huge footprint the following couple of years in the western part of the state, particularly with the ECS practice group. So we're up to 40 at that point. And then the last 2 years, really seen increase, particularly in the McLaren system, and then even the footprint up in the UP. And so now we're at 58. So it depends a little bit on how you count this, but if you think about sort of just the individual hospitals, we're at 58. Sometimes we talk about the numbers being less, but that's because we have smaller hospitals that roll up into their bigger sister hospitals nearby. So really we're at 58 individual hospitals at this point, which is really incredible and amazing to see. Okay, so that's like a pretty simple story by the numbers. Let's talk about something also probably pretty obvious, which is, what does the medic clinical registry look like? So at this point in total, we've had over 11 million emergency department visits enrolled in the data set, and over 7 million unique patients as part of that. Interesting. Let's take it sort of one step further. So this is like the geographic spread of those patients represented in the registry. So we have zip codes affiliated with the patient's residents available to us. So this is what it looks like across the state. Obviously in a lot of the population centers, you can imagine, but certainly also where our hospitals sit as well. We can zoom out one further step, which is like, this is what it looks like nationally. We're touching almost every state, maybe every state now across the country. Seem to have a heavier presence in Florida, probably because people travel back and forth between Michigan and Florida at times. So let's talk about another way to think about our numbers. So it's not about just the patients we touch, of course, it's also about the care teams that are supporting that patient care. So we have within the registry an understanding of the touches of clinicians in the care of patients in their ED course. So over 17,000 unique clinicians. So this would be inclusive of course, the ED team, but also consultants and admitting teams as part of this number. And then if you narrow down on just the emergency department care team, about 1,200 attendings and almost 4,000 inclusive of residents, fellows, nurse practitioners, physician assistants as providers as well in that care team. So obviously a really critical part of quality improvement is the people that are doing it. So let's talk about another really important part of the people part of this equation, which is of course like all the hard work and sort of key resource and work of the abstractors. So about 11 million ED visits, and of that, over 1 million have had some additional data from the chart review process of the abstraction. We've also grown a lot in that workforce. So we now almost have over 50 abstractors as part of this work. So really almost doubled in the last 4 years. And that requires a lot of training, of course, and a lot of hard work, both in all of your work and the Corning Center team with Karen and Patty, making sure the quality of that data is good and that we can trust the information and the measurement that's part of that with the snap reviews that we do. Okay, so let's talk about numbers in a different way. So this is sort of the touches that we have in the internet. So this is looking at the website and the uses of the website over time. And over nearly 6,000 total users have touched the website in the last 12 months. What it's worth, you can see the most popular days of the last 12 months as well. I'm not sure I have explanations for all these, except I think probably the September one was like the VBR deadline. So I think we had a lot of touches like at that moment. And if we sort of think about like the geographic distribution of those website interactions, yes, of course, a lot in Michigan, but to be honest, like a lot sort of outside our state as well. And we can actually zoom in one further step. So here's what it looks like globally. So we actually have people interacting with our website across the globe. We've been assured these are not bots, but actually like real people in some way start touching this website. So you're having like impact, you know, not just like in our backyard, but sort of broadly than that. Another way to think about the materials on our website are the downloads. And this is like really impressive to me, sort of the cumulative amount of downloads and materials, you know, totally related to all of your efforts around quality improvement, how that informs the kinds of tools that we build. And, you know, there's 60,000 materials downloaded in the last 4 years, and sort of the increase in the rate sort of which like that is happening is also accelerated over the last few years as well. And of course, another way to interact with the world is through scholarship. And you know, over the years, we've been able to leverage the quality improvement work, but also, of course, the data that's contained in the registry to answer, you know, research and scholarship questions. So have had publications, you know, totaling 18 over the last year, almost double the amount of that in the form of abstracts and talks and presentations, you know, news releases, press releases, and you know, the types of places that we're at are many of the National Specialty Society meetings in emergency medicine, in pediatrics, in emergency nursing, and you can see that also in the types of journals that we're in. So I got one more slide about the numbers, and certainly it's an important one. So this is the types of partnerships that we've developed over the years and the kinds of collaborations that we have, both within the Blue Cross Value Partnerships portfolio that I think Michelle was talking about earlier today, but certainly also with many other partners across the states, many of who are in the room right now. So that's Medic by the numbers. I'm happy to take any questions about that. I hope you feel some part of that work as well, as you should, because you're certainly represented in all those numbers as well.